Hi students, this is part 3 of chapter 4, human digestion and absorption. So this slide is again the diagram of the sphincters that control the passageway of substances through the digestive system. Just to remind you, there is the lower esophageal sphincter between esophagus and stomach, the pyloric sphincter between stomach and small intestine. The little tiny sphincter of Oddi is going to control the flow of bile from the liver and gallbladder into the small intestine. The ileocecal sphincter is between the ileum, the end of the small intestine, and the cecum, the beginning of the colon or large intestine. And then there are two sphincters in the area of the anus. So keep in mind that these are muscles, and for the most part, they are regulated by nerves. They also have some regulation by hormone, but again, every muscle must get a stimulus from a nerve in order to work and function. So consider that anything that is damaging to muscles and damaging to nerves can definitely impact these sphincters. Think strokes, think aging, just many conditions that are relatively common as we get older, but sometimes just secondary to perhaps a birth defect. So a lot of times when these rather simple little muscles are damaged, we see some pretty significant impacts on the process of digestion. Remember that the gastrointestinal system is entirely lined with muscle, and so the muscle movements is what you would put in the first blank here. But remember that muscles always move by contracting or shortening. Now, there are two basic kinds of muscle movements. They're both contractions. Segmentation is kind of a back and forth movement within the GI tract. And I'm sorry, go back to your blank here. This should actually be peristalsis, Peristalsis. So that's the primary wave-like and moving towards the end of the digestive system movement that we talk about. So peristalsis and segmentation just define the two kinds of movement that we see. The muscle movements of the colon or the large intestine are more sluggish and slower and are sometimes defined as being a mass movement or a peristalsis over a rather large area. So the mass movement that you might be familiar with is the bowel movement, which results in elimination of whatever we have not managed to digest and absorb. And keep in mind that when we're healthy, we're very efficient at digestion and absorption, probably running from 95 to 98% efficiency. Not many machines or mechanical things out there that can function at that level of efficiency. So stop and give a little thanks to your GI system for its incredible efficiency. Here we just have a diagram of peristalsis. Again, more of a wave-like movement of the bolus through the lumen of the whatever organ we happen to be in. And then the segmentation is a bit more back and forth and chopping. So some slightly different muscle movements. We've discussed enzymes at multiple places previously during the lecture and not really defined them. So an enzyme is a protein that is produced by your body. Your stomach produced the enzyme pepsin. We talk about sucrase to digest the sucrose molecule, and amylase, both from salivary sources as well as from pancreatic sources. So this diagram just shows us a bit about how the enzyme works. Here we have the sucrase enzyme. As a protein, it has a very particular shape. This happens to be the shape that will fit exactly with a sucrose molecule. And when the sucrose molecule comes in contact with the enzyme, the chemical reactions that happen speed up tremendously. And the function of sucrase is to split this disaccharide sucrose into its monosaccharide forms, glucose and fructose. This is now small enough, glucose and fructose, that it can be absorbed and pass through the wall of the small intestine for the most part and make its way inside the body. Now, here's my enzyme. It's now empty and it's ready to go to work and repeat this action again. Remember that most enzymes, the name ends in an ASE. So if you see that, know that you are looking at an enzyme substance, and often the first part of the name of the enzyme will give you the clue to what this enzyme specifically acts upon. Sometimes digestion does not work the way that it is supposed to work. In class, we had a little bit of discussion about heartburn or gastroesophageal reflux. And when this becomes more advanced and continues for longer periods of time, we can refer to it as gastroesophageal reflux disease. The real problem with this is not only is it painful and uncomfortable and impacts quality of life, but it alters the tissues of the esophagus, and it makes them more prone to eventually developing abnormal structures, potentially esophageal cancer. So it isn't something that we want to just ignore. There are some foods that are known to increase our tendency towards reflux. These include citrus, caffeine, chocolate, fatty foods, spicy foods, onion, garlic, and for some people, tomato-based foods. We also talked briefly about how the hydrochloric acid and the mucous membrane sometimes fails to protect the stomach, and the stomach will actually begin to auto-digest itself. We then have a peptic or a gastric ulcer. We know now that the primary cause of this is actually a bacterial infection. It's called Helicobacter pylori. Yeah, look that one up. Helicobacter pylori. And it actually is the infection with this bacteria that causes the mucous membranes to break down and leads to the development of the ulcer. Conditions that certainly promote this, alcohol consumption, aspirin, and smoking. So the treatment that we see for the peptic or the gastric ulcer is going to be medications. There are medications that will kind of block the release of hydrochloric acid, but if I have to treat a bacterial infection, it will be an antibiotic that will be used to clear up the Helicobacter pylori infection. It tends to be very individualized, but the patient or yourself or your family member needs to be aware of the foods that actually increase the painful symptoms that they experience. Peppers and spicy peppers and ground black pepper are certainly indicated by many people. Caffeine is indicated by a lot of people. But again, someone might be bothered by tomato products and the next person is not. You may be able to tolerate 1 glass of tomato juice, but if you decide it's very tasty and you have several, you will get into trouble. So again, consider the amount that you're consuming. Okay, just a diagram showing us that the lower esophageal sphincter is relaxed, acid is allowed to reflux into the esophagus. Esophagus doesn't have this nice mucus layer, and it starts to become inflamed and eventually may be quite damaged. A normal mucosal lining of the stomach, and one where we've seen a peptic ulcer form. I'm going to let you go ahead and read through some of these recommendations for the prevention of ulcers and heartburn, either from ever occurring in the first place or from then reoccurring if we have once experienced them. A few other issues when digestion goes awry: gallstones, food intolerances, intestinal gas or flatulence, constipation. In this line, put in fiber, fluid, and exercise, potential for laxative use. In diarrhea, we're concerned about replacing fluids and electrolytes. And we also have conditions known as irritable bowel conditions and hemorrhoids. Let's take a look at some of these. So here you actually see the gallstones that have been removed from a removed gallbladder. What actually happened is, for some reason, the bile remained in the gallbladder and the gallbladder wasn't really stimulated to push its bile out. Like many things, when the bile sits there for days or weeks and it doesn't move, it may actually dehydrate and crystallize out. And so we see these stones forming. Now when the gallbladder attempts to contract, it's crunching on these stones, and it can be intensely painful. So in this case, we see a gallbladder that had to be removed, but sometimes we can come in and break up these stones with ultrasound. That's a little more likely in kidney-based stones, because I can get by without the gallbladder. So, the treatment depends on really how severe and how advanced this is. Here are some of the factors that make people more at risk with the formation of gallstones. So, fortunately for us, some things we cannot control, like female gender and pregnancy, but many of the recommendations are good, healthful recommendations that we would make to people for a variety of other reasons. Okay, a pretty prevalent condition in the United States and increasingly around the world is the whole spectrum of diverticular diseases, which impact the colon or the large intestine. So this is an infected diverticuli, and so the term that is used is diverticulitis. It's inflamed, it's swollen. Remember, there's a lot of nerves around all parts of the GI system, and so this swelling and this inflammation is going to be marked with pain. Diverticulosis is the condition of having diverticuli. These at this point are not inflamed, and so we may not know that these exist. We generally believe that these diverticuli are caused by kind of chronic constipation over the years. And as dry fecal material slowly passes through, pressure kind of builds up in the colon, and to deal with the pressure, the walls actually kind of give way and have a little pop out. Now these are weak, and in worst case scenario, the diverticulum start to bleed, and may even cause the colon to perforate, which means that all of the fecal contents will flood out into the lower abdominal cavity. That, of course, is a pretty serious condition. If you'd like to watch some video on the prevention of diverticuli, I believe this is the Dr. Oz video, and it's kind of fun. Move it to about 4 minutes and 30 seconds in to watch the rather infamous pooping video. So finally, our content review. What type of muscle movement is most commonly seen in the esophagus and the small intestine? Hint, versus the colon or large intestine. Number 2, what's the #1 cause of stomach ulcers? And then 3, can you list some treatment ideas for an individual who is suffering from ongoing or chronic constipation? Okay, end of this chapter, hopefully end of recorded lectures, and we can put the polar vortex behind us and move on to normal DTS 250. See you later.